Hi friends, we are back again at Nexus Medodent. I hope you're enjoying the implant series. The doctor had some surgeries today, so we'll be taking a break for today and hopefully she'll be available tomorrow for a new topic for you guys. So meanwhile, I thought that I'd do a quick video for you based on my experience, and I want to give you a very interesting tip which is going to be very useful for you if you listen this video very carefully till the end. It's gonna solve 80% of your handpieces problem. So have you ever noticed that your handpiece water supply getting blocked within few months after you had purchased the handpiece? So we are going to solve that problem in a very easy way, which you can do it at your clinic itself, and you don't need a technician's help or you don't need a company's help. You can follow these steps and there are 90% chances that the water blockage might be resolved at your clinic, and the water blockage should not happen again. I'm going to give you a pro tip for that also. So we recommend you that you should use distilled water in your facility, which is gonna eliminate any chances of water blockage. For example, if you're using RO water or you're using some other water, and while doing the surgery, there is a lot of dust going on while you're working in the patient's mouth. There is some cutting you are doing, and then there is some particles which are going in the debris which is going in the holes of the Airotar. So this is also one of the scenario where the water blockage happens. So number one is remember to use distilled water. That is the most important thing. And number two is periodically clean your handpieces. So apart from lubricating, also clean the handpieces. Clean the handpieces means open the back cap, remove the cartridge and wash it completely, oil it from there, again put your cartridge back, and then you're good to go. There is other method also. You can remove the cartridge. If there is a lot of debris which you see which is caused inside there, you can see a lot of black layering in your handpiece top metal part where you put the cartridge. You can clean it completely with a tissue, with a spirit. You can clean it completely, wash it, not a problem, and then put some three-way air pressure, remove the debris, clean it completely, put the cartridge back, oil it from behind, put the cap back, and you're good to go. So after following these two methods, if there is still blockages there, I'm going to give you a very interesting tip which is also be very helpful for you. So let's begin the video and let me show you the trip. So today we have a NMD German handpiece. This is a very good handpiece and this is a top selling model, and I personally like this handpiece a lot. Let me tell you a quick advantages of these handpiece. This handpiece is a high torque handpiece and it's a LED handpiece. The LED is generated by the dynamo. There is no fiber optic required, and it's got a SDP light which is embedded inside. The light is not bulging out, which makes it more sustainable for autoclaving. We give 100,000 hours of warranty on light itself. The light is so good. There is a coating done on the behind where the coupling fits for the thread so that it doesn't get worn out easily. And of course it's a triple spray handpiece and high speed, high torque. It's a very good handpiece. If you would like to order this handpiece, the name goes by German TU handpiece. It's available in SU and TU both. So it comes with a small file cleaner sort of a element, and it comes with a back cap opener. So if there is a blockage and you don't see any water coming in from all three, or you see the water is coming less, or if it is coming in one or two holes, then what you should do is follow these steps. So we are going to open this up and bring this out. And So this is out, and what I'm going to do first is I'm going to put this wire in the holes. And I'm gonna bring out, put in and bring out. I should put in as much as it goes inside. I'm gonna repeat this in all the 3 holes. This is step number 1. Step number 2, if you still see the water is not coming out, so there is possibility that there is some debris inside the water line here. So we are going to give a lot of pressure so that the debris comes out. So we are going to open the back cap. We are opening the back cap here, and we are going to use a 10 ml syringe. We have this syringe, the name goes by a utility syringe. It's a very useful syringe, and there are multiple uses for the syringe apart from cleaning the debris from this handpiece. This can also mix your light body material. You can scoop it up, and then you can push the light body material with the help of this syringe. It's a very interesting syringe. You can also do some sort of irrigation work with this. You're doing an external bone cutting. The handpiece does not have a irrigation supply. You can give supply from here also. It's $100 syringe, but it's a very useful syringe. So what I've done is that I'm gonna fill up some water in this syringe, and there is some water filled up. You can fill up the full water in this syringe, and then you have to find the water pipe. You have to fit this syringe here, and then you have to apply full pressure from here till the time you see all the 3 holes are working. Still not working. If there is a strong blockage, you might feel a lot of resistance when you are pressing the syringe down. That would easily you can understand that there is blockage which is causing the water not to pass from here to here. So again, try it, apply a lot of pressure, and eventually all the 3 holes will open up. Make sure there is no leakage from here like it just happened. I did not hold it properly, so the leakage happened, and the opening should be tight enough so that there is no leakage from this side, and all the pressure of the water should move from here. So after following these 2 methods, I am sure that your debris is cleared up and your water is coming out from these holes. Try to keep this chamber also clear. Once a week, open the cartridge, clean it inside like the way it is right now, put the cartridge back, lubricate it, and you are good to go. So friends, I hope you like this tip of mine. We have done this several times, and we have helped a lot of dentists to open their blockage, and it is a very helpful trick. You can try it sometime whenever you face this issue in your clinic next time. So stay tuned, subscribe to our channel if you've not subscribed yet, like our video if you like the video, and that will give us motivation to give you more secret tips on wear and tear, maintenance, introducing new spares, new equipments, and variety of other things. Hope to meet you soon again. Thank you. Take care.